I'd like to invite Dr. Reesha to give her talk on the use of angiography and autofluorescence in uveitic entities. Dr. Reesha, please.
Good morning. First, let me thank Dr. Shane and Dr. Sudarshan for giving me this proxy opportunity. I'll be dealing with angiography and autofluorescence in uveitis conditions. Okay. Okay. As we all know, ancillary investigations are the backbone of uveitis workup. They help in making the diagnosis, ruling out certain differential diagnosis, and also helps in monitoring inflammation during follow-up. FFA helps to analyze blood flow in retinal vessels and also detect inflammation of vessels. It detects neovascularization. It gives information regarding RPE and choriocapillaries. It also gives an idea about the optic disc condition. Here, this is an example of occlusive vasculitis. FFA gives complete idea about the extent of vasculitis and about the ischemic status of the retina. So, case of serpiginous choroiditis, FFA gives the complete extent of the choroiditis, and it also gives an idea about the RPE status, which gives the prognosis of the condition. In APM PPE, FFA shows early hypo and late hyperfluorescence, and you can see in FFA the number of lesions are much more than in a fundus photo. In Eales disease, in the active vasculitis phase, early venous phase shows staining of veins with extravasation of dye in the late phase. We can classify into different stages according to FFA into active vasculitis phase, ischemic phase, and neovascularization phase. FFA gives an idea about the stage of the disease. And after treatment, the active vasculitis become healed lesion, and it stain without any extravasation. So it helps in following up a patient with treatment. And it also helps in detecting certain conditions, like in Bassett, FFA shows the typical vasculitis patch. Thus, it helps in diagnosing certain uveitis conditions. In VKH also, the typical FFA pattern is seen here, pinpoint early hyperfluorescence with late pooling in the subretinal space. So these typical patterns helps in the diagnosis. In posterior scleritis also, there will be pinpoint leaks with disc leak. So FFA helps in differentiating some conditions. It helps in detecting early complications like CNVM. Sometimes may be mistaken as an reactivation of an old scar. So FFA helps in detecting these early changes of CNVM and also CME associated with an chronic intermediate or posterior uveitis. A word about OCT angiography. It's a non-invasive depth resolved on-fast images of retinal capillary networks. FFA is still essential for detecting vascular leakage and detecting peripheral ischemia and neovascularization. This is a picture of Bassett octa. We can differentiate superficial capillary plexus and deep capillary plexus changes separately. In choroidal inflammatory conditions, FFA detect choriocapillary flow voids and early inflammatory CNVM changes. Now comes fundus autofluorescence. It's an in vivo imaging method for metabolic mapping of naturally or pathologically occurring fluorophores of the ocular fundus. See the normal autofluorescence picture. The amount of autofluorescence depends on the amount of fluorophores. Again depends on the phase of inflammation. So in the active phase it will be hyperautofluorescent due to increased fluorophores, and in healed stage it will be totally hypoautofluorescent. This is a picture of active toxoretinochoroiditis. In the active phase, you can see an amorphous pattern of hyperautofluorescence, and as the lesion heals, it becomes more and more hypo, and when it heals completely, it becomes jet black. And it also helps in detecting early reactivation of an toxos lesion. Similarly, so the pattern of healing is described as amorphous pattern of hyper and a ring pattern of hyper and hypoautofluorescence and atrophic pattern of hypoautofluorescence. Similarly, in serpiginous choroiditis, it helps in detecting early reactivation of an old lesion. It appears as a ring pattern of hyperautofluorescence at the edges of the old lesion. And as the lesion heals, it becomes more and more hypo, and when it heals completely, it becomes totally hypoautofluorescent. So the take-home message is fundus fluorescent angiography and FFA OCTA helps not only in making correct diagnosis, but also helps in documenting and following up patients following therapy in a uveitic conditions. Thank you.
Very nice talk. I just wanted to know, are you using OCT more often now to make a differential diagnosis as to what is the cause of a choroiditis or how to proceed further? Do you use OCT as a diagnostic thing?
Sometimes in retinochoroiditis toxo conditions, it helps in detecting the status of retinitis and choroiditis.
Helps you to know whether you are dealing with the retinitis or
only retinitis, retinochoroiditis, or purely a choroiditis.
So that helps you in making an etiological diagnosis.
In
also?
ruling out certain differential diagnosis.
Have you ever experienced that this can help you and you need not do the serum biomarkers then, or you still depend on the serum biomarkers?
Still
Still
depends.
depend on serum biomarkers. Okay, thank you.